Politics, please. Senate Republicans took the first step towards repealing Obamacare, and Donald Trump is tweeting out this morning, here's the tweet, "The Unaffordable Care Act will soon be history." Marc Siegel, the doctor, is with us. The point is, what follows Obamacare? What do we replace it with? Are you going to tell us?
Well, I think we can replace it with something more affordable. I think President-elect Trump is absolutely right about that. Look at it this way. You go to the doctor's office and you have a prefix meal, and they load it up, the lawyers do, with everything that's supposed to be in there. Mammograms are covered and maternity is covered, and you're saying, how did lawyers figure out what's supposed to go on in the doctor's office, right? I'm asking the same question. We're going to change to a banquet-style meal where you get catastrophic insurance. Everybody gets. But then the doctor and the patient gets to choice. Do I need salad? Do I need a meat? Do I need a dessert, right? Is the dessert good for you, right? Maybe it's not because you're overweight already. Listen, it's a personalized approach, and that fits in with high technology. So here's how it's going to work, Stuart. It's going to be catastrophic, high deductibles, and health savings accounts being expanded. So you pay out of pocket with big tax deductions, and you get to choose what you need.
Because the mandate is gone. The mandate says you must cover this, and this. Get rid of the mandate, and you then have the buffet where you say, I want this, and I want that, and you pay for it. That's it?
Yeah, because, look, the mandate ropes young people in, cons them into the game where they have to have this big prefix, and they don't even have an appetite. They don't even have they have no appetite. And they have to have this. They're paying for mammograms. They're paying for diabetics. Now, I mean, look, we're not socialism here, right? So I'm sympathetic for a 70-year-old diabetic having their care paid for, but I don't really want my 25-year-old healthy individual to pay for it. And they know that. That's why they're taking the penalty. One more point. Do you know that the federal government pays $42 billion for the subsidies on those state exchanges? $42 billion a year. And the individual mandate that you just mentioned only brings in $3 billion. So everyone's talking about the problem with repealing the Obamacare taxes, but the amount the federal government is paying in Obamacare is huge. So I think, some of your guests have said it this week, I think they're right. I think getting rid of the Obamacare taxes will be a big relief, and getting rid of this big program that we don't need, federal regulations.
I want a buffet. Pick what I want.
Yeah,
Doc Siegel.
You're skinny.
I am now. Thank you very much indeed.